Hello, everyone. Welcome to our Tush Talk about managing the fear of cancer recurrence and the emotional impact of cancer. Today, I'm joined by Dr. Sophie Lebel, who is a clinical psychologist and a professor of psychology at the University of Ottawa. Her research focuses on cancer survivorship and psychosocial interventions. Her expertise is on managing fear of cancer recurrence. Thank you very much for being here with us today, Sophie. We're very lucky to have you.
It is really my pleasure, and thank you for inviting me.
Wonderful. Let's get into some of the questions that come up quite often. Patients often tell me that they feel fearful, they fear that the cancer will come back or that their quality of life might be restricted. What is fear? What does fear sort of look like?
All right. So that's a great question. Right off the bat, I want to say that fear is one of our common emotions like joy, anger, sadness. We actually see fear as a core emotion as something adaptive in the sense that fear could imagine, that all of a sudden we're in the same room and then there's something dangerous, like a tiger. We often talk about the tiger that would appear. You and I would both be scared, and appropriately so, because this is a danger. So our bodies would get all tense. We'd have this adrenaline rush that would allow us to escape what's dangerous. So we say that fear's got an evolutionary basis. So fear in itself is not bad. But in the case of cancer, what happens over time is that you're scared, or more actually like worried. And I know that's your next question. What's the difference between fear and worry? So we'll talk about that. But when you're a cancer patient, if you're scared and anticipating things that could happen, you could be living in this state of like almost chronic fear. And that becomes very taxing for your body to always be prepared to face an unknown hypothetical tiger that could happen in the future. So my take-home point for this one is that fear in itself, just like anger or joy or sadness, are not bad emotions. They're just an indicator that something is happening. You need to pay attention to this something and maybe manage this. And we'll talk about some tools to manage the fear.
Nice, thank you. And yeah, so my next question, as you said, is worry and fear the same? If not, how do they differ?
Right. So they're not the same. So for me, fear is really sort of that like reaction, like almost like automatic reaction to a threat or an actual threat in the environment, which again, as I said, is from an evolutionary perspective, appropriate and adaptive. You need to just mobilize yourself and get out of danger. Worry is a bit more complicated than fear because it's an emotion. You have the same sort of anxious sort of preoccupation, but you also have thoughts. Usually the worry looks like a what if. Well, what if my cancer comes back? And then you almost said in your introduction, well, then maybe my quality of life will be compromised. Then if that happens, will I still be able to work? Probably, well, if the cancer comes back and my quality of life is bad, I'll have to quit my job. If I have to quit my job, then how are we going to afford, the mortgage? Oh my gosh, and we had dreams of sending kids to college or university. We won't be able to do that. And then, so it sort of spirals with the what ifs. And the key for the distinction between fear and worry is that fear is in the now. The tiger is now in the room. Worry is about something that could happen in the future. And that's really, I think, going to be a key point of today's talk is that when you're worried about something, you're worrying about something that could happen in the future, but may not actually happen. So you're planning for a hypothetical something, whether it's the cancer that's going to come back, how it will affect your quality of life. But let's keep in mind that these things haven't actually happened yet. But I too sometimes will spend time sort of ruminating. And I know I'm worried when I feel like I'm like a little hamster spinning in its wheel. I'm just going around and around and around the same concerns and not really finding my own solution. And I'm just sort of spinning, trying to come up with a solution when sometimes there is no solution because we're talking about a problem that hasn't happened. It's something that may happen in the future.
Right. Thank you so much. Patients find it hard to cope with the fear of recurrence. They're unsure about how to get rid of that fear, and it kind of consumes their every thought. Are there coping strategies that you could offer? What's your...
For sure. I think I would put worry about cancer, fear of cancer recurrence, and sort of a broader problem for cancer patients and for people in general. It's uncertainty, how to manage uncertainty. As human beings, we don't like uncertainty. We'd rather know that something is about to happen or will not happen. but the possibility that it may happen is really difficult for us. It's a challenge. And with cancer, it's the same thing. You're probably told as a cancer patient that there is an X% chance of the cancer coming back in 5 years. And I've worked with people for whom that percentage was really small, but still it was very hard to live with. And I've worked with people for whom the percentage was really big and they were somewhat okay. So we all have different preferences and tolerances for how much uncertainty and unknown we can handle. Now, when it comes time to coping, I went recently to a great talk by a colleague at Princess Margaret, and she said, because we have such a hard time tolerating uncertainty, sometimes it's best for our brains if we sort of say, okay, well, let's plan for the worst, let's plan for the better. So the best case scenario, we have a plan. Worst case scenario, we have a plan. So we prefer living with more certainty. So that's a way to sort of get more certainty and more control out of your cancer journey, to make a plan. It's important to hold on to hope. So be hopeful that maybe this will never happen and then you'll enjoy years of good quality of life. But be prepared in case things don't quite happen as you want them to, and you actually have a plan for if things don't go well, and you've discussed this plan with your supportive circle, your loved ones, your family. In terms of practical tips and tricks, so I find if you're having a bad day and you have a lot of these thoughts, sort of acknowledge, okay, I'm having a bad day. The worst thing people can do, I think, is sort of hold on to the thought and try to control it and really worry about the thought, oh my God, why am I thinking about this? I'm going to make myself worse. There's no evidence that if you're thinking about this, it's actually going to make it happen or it's going to be worse. You're going through a tough moment. I explain to my patients as you have to ride the wave. You're caught in the ocean and now you're caught in the tide and the wave. Just ride it out. This too shall pass. You're not going to stay in this anxious, worried state forever. The worst you can do is sort of fight it and fight it. Just let it happen. You will not stay in this state forever. Just like any emotion passes, this will pass. So just sort of tolerate, it will pass. While you're waiting, it never hurts to turn to good coping strategies, whether it's going for a walk, exercising a bit, writing down in a journal, writing things you're grateful for, talking to a supportive friend, a supportive family member, partner, maybe another cancer patient understands what you've gone through, turning to relaxation techniques or mindfulness or yoga. All of these would be helpful.
Perfect. Thank you so much. Several of our support group participants are in the no evidence of disease phase, and they often have quite severe anxiety leading up to scans, even if it's been several years since cancer. Is this sort of normal? Do you have any tips, tricks for these individuals?
Oh, for sure. So I think, by the way, it's very common to experience fear of cancer recurrence on occasion. So I wouldn't worry if a patient was coming to me and said, yeah, I find, my annual or semi-annual or every 4 months, 3 months, whatever it is the case, I find that period hard. I wouldn't get particularly worried about that. We'll talk, I think, later about when I would suggest that maybe we need to look at your fear of cancer recurrence. The majority of cancer patients find waiting for appointments or scans or test results difficult. And my best strategy for that is sort of anticipate and plan and distract. So if you've been a cancer patient for a while, predictably, this is going to be a challenging time. So sort of plan for how you're going to spend maybe the week or a few days or a little longer where you're going to be waiting for results. Okay, anticipate, tell yourself this is normal, remind yourself there's no evidence, nothing has changed from 2 months ago. There's no evidence that the cancer has come back right now. Just sort of wait out. This is a longer wave, perhaps. And I find during that phase, again, sort of healthy distractions. Keep your mind off things because sometimes people find it hard staying at home and sort of just waiting. So have some activities that are pleasant for you, that are meaningful for you, sort of lined up. Again, talk to maybe another cancer patient who will definitely understand what you're going through. And one of the things we discuss in the support group that I lead is, what do you do waiting for test results? Like, do you go check your online test results if they're available or not? So here in Ottawa, we have something called My Chart, which allows you to go ahead and sometimes you see the scan results before you meet with your oncologist. I think that's been like an interesting evolution of technology, and some people want to know and some people don't want to know. So I think it's important for you to know yourself and say, okay, are you better if you understand, if you know ahead of time and you feel comfortable reading those results? Because sometimes the information is confusing and words that you don't understand. Will that be helpful to you or not helpful? So I would say manage that and decide whether you want to know ahead of your appointment with your oncologist.
Yeah, absolutely. Sometimes I'll see on Facebook support groups, they will upload their scan and be like, hey, can anybody help me read this? And it kind of creates more anxiety because
it can, that's it.
Yeah, different answers.
For sure, because it's so ambiguous. And I've read, scans, let's say for routine stuff too. And I'm like, I have no idea what this means. This thing here, is that okay, bad? I don't know.
Yeah.
And sometimes it just turns out to just be technical terms that describe normal things. So again, sort of you have to know your preferences and tolerance. Some people really like having a lot of information, it makes them feel better. And some people prefer not knowing and sort of waiting.
Yeah, absolutely. So it takes us to our next question. Then during the cancer process, patients lose a lot of their control, a lot of the control that they once had in their lives, and they find that to be one of the most difficult aspects of cancer, actually. How can a patient find ways to take control back or reduce the discomfort around that lack of control?
Yeah, I think this is like a universal concern for cancer patients. And it's one of the first things I learned when I started working in oncology. I had a supervisor who said, imagine you're used to driving your car and you're the driver, you're in control. Now you're not even in the back seat sometimes. I find sometimes it's almost like you've been, shoved into the trunk and somebody's closed the trunk on you. So it can really feel upsetting to lose control. But sometimes people feel like control is just this one thing. And in one of our interventions, what we do is we help people break down areas of their life, right? Your life is not just this one thing, but you might have, you say, your family, your partner, your work, your spirituality, your physical health, your mental health, your friends. So you have different parts of you. And you may feel that you have maybe, let's say, less control over your physical health, but maybe you still have some control over your spirituality or your friends. So you might try to focus about which are the areas that are important to you. That they could be your relationship with your children or your partner, or for some people it's work or combination. And remind yourself that you still have control over some of these areas. Mm-hmm. That's one way. Another way is to try to think about what is predictable about cancer. So after a while, you know that you're going to get these scans. You know that you know about your follow-up care. I think it's important for people to gain a sense of control, to make sure that there are no gaps in their medical knowledge, because cancer is so confusing at times. The treatments, the follow-ups. So it's important to ask questions and feel like, okay, you know what you need to do. You know what your follow-up looks like. You've got confidence in your team, whether it's oncologist, a nurse, your family physician, or combination of, you know where to go, who to talk to if there's something. A last thing I would like to say about control is that I think for me as a psychologist, I've seen cancer as an opportunity for people to work on things that maybe was in the back burner, that relationship or that thing from their childhood, or this pattern they have of giving too much, or just something that's sort of been nagging them. And now you've had this sort of life crisis and you want to change things. Mm-hmm. Cancer is a really good time to focus on what is really important to you. What are your values? What are your goals? What is really meaningful to you? You've probably seen this before, but so many people tell us, I can't stand the BS anymore. I've got no patience, for the pettiness and the this and the that. I'm really focused on what matters to me, what's important. I think one way to regain control is really to remember, what are your values? What is really meaningful? What's a top priority for you in your life? And focus really on those areas and sort of, eliminate the rest.
Yeah, absolutely. I hear that a lot. The worldview and the values, the beliefs, they all sort of shift a little bit
Yes,
after a
yes.
cancer diagnosis. Um, so grief is a common emotion that comes up as well with patients. They grieve the identity that they lost throughout the cancer journey. What advice can you offer these patients? Is there a specific way that they should be handling their grief?
That's a really great question. First of all, I want to say yes, grief is, I think, part of the experience. It's grief for, like you said, the identity or maybe the plans you thought you were going to have in the next 5 years, usually around, let's say, retirement or family or whatever. So sometimes it's the grief of your physical health. I would sort of say there's no universal way of grieving. And we used to think about those stages of grieving, that you go through this stage and that stage. Research shows that that's not necessarily true. Not everybody goes through the same stage, or that the stages go like in a linear fashion. So there is no right way for one person to grieve. I would say, of course, I encourage people to talk and to find a supportive space. Again, I find support groups are great for that because you'll be able to express, I am sad that I'm no longer able to do this. And you'll have people who understand what you're going through and can validate that. So I think expressing those griefs and sort of recognizing that, yes, it's a reality. At the same time, when it comes to grief, I find I help sometimes my patients distinguish between, okay, so let's say an example is I've worked with many people who were physically quite active, and let's say they were runners before. And now because of your cancer, you can't run. And that was a big part of your identity. Let's say running was a big part of your identity. But maybe you could, instead of completely giving up on that, could you do that same activity that was really valuable to you, but in a reduced way, in a different way? And if you can't quite, if you could say, if you're told, okay, you can't run at all, could you come up with a different activity? So it's either modify the activity or change the activity. Is there something else that you could do that could replace that? So that your life still has, the same sort of meaning or joy, let's say, of the camaraderie that you got from running, or, setting goals for yourself. So I would say don't give up totally on the idea, and grieve something completely. Sometimes it could be modified or replaced by something close to it.
Mm, yeah, that's great. I was speaking with a patient and their partner last week, and they both expressed that anger often comes up due to the missed opportunities. They question why cancer happened to them, and they reflect on the sort of negative impact it's had on their family. What are some strategies they could use to cope with the anger and express it in a healthy manner?
Sure. Again, anger is like one of those primary emotions we talked at the beginning, like fear and sadness. I would often ask people, so what are they angry about, and sort of validate that. Yes, it is unfair. Cancer to me doesn't matter what age a person is at, what stage. There's an unfairness to it. It's unfair that it's happening to you, and you had this dream with your wife of this and that and your family, and now you are probably not raw, but your dream is modified, impacted because of that. So yes, it is unfair. The why me, I think there is no right answer there. I encourage sometimes people to explore that question, but then move on from it, because you will never quite find an answer as to why you. Sometimes it's just luck of the drop. I get many people who come to me and they're like, I've never, I have no risk factor. I exercise, I eat well. Why did this cancer happen to me? And there's really no reason why. I find anger as an emotion is interesting because it's a valid emotion, but underneath the anger, there's often sadness and loss and grief. And sometimes it's easier for us to be like, I'm mad. And that emotion might be a bit more comfortable for some people than the more sort of vulnerable, soft emotion of, I'm sad, I'm scared, what are we going to do? So I would encourage people to ask themselves, okay, so you're mad. Yes. Is there something else that you're feeling that maybe we haven't talked about? A little bit of sadness. Maybe you're scared for what's going to happen, and explore all of that. And again, sort of see, okay, so your life plans have been completely disrupted. how can you regain a sense of control? Maybe you don't have that sort of 30 years you were envisioning. Maybe you do, but you still have today. Most likely you have tomorrow, although we don't know, but most likely you have today, most likely you have tomorrow, you have next week, next month. What are you going to do with this time for yourself, for your wife, for your family? Sort of move away from that. Last thing I'll say, of course, is sometimes anger could be a sign of, or irritability could be a sign of depression, right? So it's normal for cancer patients to go through ups and downs, emotional ups and downs. I don't panic when somebody tells me, there are days where I feel sad, totally normal. If it's been, let's say, a couple of weeks that you notice that you're more irritable, you're crying more, you're more sad, might be, and you're finding that like your outlook has changed, you're a bit more lethargic, you're not quite the same, you find that you're slowed down, your sleep is affected, your appetite's affected, you feel more guilty, you feel more hopeless, you're having suicidal thoughts for sure, if that's the case. If your family feels like you're a little different, you feel like you're a little different, you're concerned about being depressed, I would say definitely talk to your oncologist, talk to whatever team is there, talk to your family physician, and see if there's something happening there for which there are lots of good solutions.
Yeah, thank you for that. That's really great outline there. Some patients ask whether their level of fear and emotions are normal. Is there a point where one can feel their emotions or fear too much?
I get a lot of people coming into my office and we talk about their fear. One of the things I'll use to distinguish between when it's kind of a normal fear is sort of a fear that's what I call occasional. And when you do get it, it goes away pretty fast. So you feel, and when it comes on, it's tough, but you feel like you can manage it. People that, in my experience, need help and need perhaps an intervention, additional support, are people who are going to say to me, I experience this fear almost daily or several times a week, at least. That's what I'm looking for, sort of that several times a week to daily range. And they tell me that when they get triggered, so a trigger could be, let's say they went out and their neighbor told them, hey, did you know that so-and-so got diagnosed with same cancer as you? And then they're like, whoa, okay. And when they get triggered, their fear kicks in, they'll tell me sometimes it sets in for like several hours. Right? So it's not just a fear that comes and goes, but it's a fear that's going to come and stay with them. Some people have told me like it's like a little devil on my shoulder that's always there for me. So those are people I find that probably need additional help. So they tell me, it's almost there. It's there most of the time, if not all the time. And they're experiencing a lot of strong emotions around it. So strong fear, sometimes a panic, strong anger, strong, lots of sadness. And they feel sometimes it's impacting their daily life. So then people ask me for examples of daily life. So that could be, for example, people who are not sure they want to go back to work. Part of them wants to go back to work, but another part of them is like, I don't know if I can handle the stress of my job, because if I go back to work and I'm stressed, what if the cancer comes back? Another example I like to give is I once worked with a fairly young man who used to be involved in like various sort of community sports, sort of rec leagues, and he avoided going to all of that, even though he enjoyed them and kind of wish he could. Because what would happen, he would show up at his league and people would, the other guys he was playing with would be like, hey, how's it going? How's your health? And just that question for him would bring it all back. So because he was afraid people would kindly ask him, hey, how's it going? How are you doing? He stopped going to these activities. So that's quite an impact on his life. So that's what I mean by an impact on your day-to-day life.
Yeah, that makes sense. And what sort of interventions, I guess, would a counselor use with someone who's got that level of fear?
Right. So what's really great is that in the past 10, 15 years, there's been a lot of interventions tested in Canada, in the States, Australia, Europe, to manage fear of cancer recurrence. So what we found so far when we combine these interventions together is that if you participate in a one-on-one intervention or a group designed to help with fear of cancer recurrence, chances are it's going to help you. These groups tend to be, or one-on-one interventions also tend to be brief. So we're not looking at a year of therapy, but on average, studies found it's about 6 to 7 sessions of really focused therapy that we call cognitive behavioral therapy. So cognitive behavioral therapy, as the name suggests, focuses on your thoughts, cognitions, and on your behaviors. So you'll learn to pay attention to your thoughts, such as, oh my gosh, I have this headache. That means my brain, the cancers come to my brain. I've got brain mets now. I'm going to die. So you're learning to pay attention to what you're telling yourself and coming up with more helpful statements. And you're looking to pay attention to your behavior. So what do you do when you have the fear? What can you do that would be more helpful? Like we talked about, gentle exercise, relaxation techniques, decreasing, sort of trying to shove the fear away, but staying with it. So there are things that you can do, and they're very well researched at this point. So hopefully you would find a counselor, a psychotherapist, a psychologist, social worker, somebody that has read the literature and would be able to, offer you some practical ways of coping with this.
Yeah, that's great. So we've covered some signs and symptoms and some professionals that might help patients who are experiencing high levels of fear. Are there any characteristics, approaches, or modalities that patients and their loved ones should ensure that their social worker or psychologist, psychotherapist use?
So I think in terms of what's been researched so far is I would sort of first say, go to your cancer center and see if, what kind of resources you have access to, whether it's through, the psychosocial oncology department, if they have one. So what do you have access to? Is there a social worker, some sort of counselor, a psychotherapist, or a psychologist that could help you with this fear? One sec. And then when you discuss your options with them, sort of ask them what the therapy would consist of. As I said, cognitive behavioral therapy has been well researched, as well as something called mindfulness. So I don't know if people in your group will know what mindfulness is, but it's sort of a later evolution of cognitive behavioral therapy where we learn to just mindfully observe our experiences. So our emotions or physical sensations. And it involves a lot of meditation and sort of daily practice to change the way you relate to your inner experiences. So it's very cool. And what I like about mindfulness is that it's sort of a broader umbrella of skills, if you want. And mindfulness has been shown to help cancer patients with all kinds of anxiety and depression symptoms in general. And a lot of places will offer mindfulness, maybe not mindfulness specifically for cancer patients, but most likely you'll be able to find online or in your community some sort of mindfulness program, which are usually quite intensive. So we're looking probably at 6 to 8 weeks of group practices with a lot of homework to try to practice these gratitude, these meditations, these tools. And for some people, this works really well and can have an impact on many sort of domains of your quality of life. So if you can find a practitioner that offers that, wonderful. There's no trial research that shows that CBT or mindfulness is better than the other for fear of cancer recurrence at this point. So sort of see what's available in your area, try it. I find for psychotherapy, a lot of it is like how much you click with the people who are going to offer the intervention. So sort of meet with the person, then see how you feel and how, if you would like to work with them.
Yeah, absolutely. Most practitioners will have that 30-minute free consultation, and you
yes
meet with more than one to make sure that you click with them.
Mm-hmm. Mm-hmm.
Wonderful. That's all the questions that I have today. So thank you so much for joining us. And I just want to thank everyone for joining us as well. And if you have any questions at all about the talk or you require additional support, please contact me at support@colorectalcancercanada.com. Thank you so much, and we'll see you at the next Tush Talk.